Well, the Federal Minister of Public Services and Procurement, Oakville MP Anita Anand, joins us this morning for a one-on-one on Canada's vaccine rollout. Very nice to see you again, Minister.
Great to be here. Thanks for having me.
And we were talking, Bob and I were talking earlier about, who knew a year ago we would know infectious disease specialists so well. Who know that we would be talking so often with a procurement minister?
Exactly. We've come a long way in the past year. We've had really three big movements in the area of procurement. The first was our procurement of PPE. We procured 2.7 billion items of PPE with 1.4 billion of those items already delivered. We wanted to plan for the long term, a possible second or third wave at the time we ordered that PPE. Then we moved into procuring rapid tests, 40.5 million rapid tests procured and over 20 million of those tests delivered out to the provinces and territories. And now, of course, we are into the third part of this movement, which is vaccine procurement, and we are seeing deliveries ramp up of vaccines across the country. 8 million vaccines will be delivered prior to the end of this month, and then 36.5 million prior to the end of June, and then 117.9 million prior to the end of the summer. So we are really looking at a serious ramp up across the country. The provinces and territories have told us they want vaccines, they're ready for vaccines, and that's exactly what the federal government is providing.
I wanted to ask you about the AstraZeneca vaccine, the Oxford one, because there are 9 European countries right now that have kind of put the use on that on hold because of the possible link to blood clots. What are we doing here?
Well, it's really important to note that my area is to bring vaccines into the country, and that's exactly what I'm doing. But from a health standpoint, what we in Canada are doing is following the advice of the regulator, Health Canada, and making sure that that advice is front and center. And in addition, there is the independent committee called the NACI, that's our Committee on Immunization, that will be continuing to study these issues and making recommendations and guidance.
Looking ahead to the next few deliveries, what's the bulk of them going to be? Is there a particular type of vaccine that's coming that we're going to get more of? And what about the delays that we're hearing, manufacturing delays with the new Johnson & Johnson one shot?
Well, these are great questions. Let's start by saying that our steady deliveries are of Pfizer and Moderna at this time, the mRNA vaccine. Those were the first 2 approved vaccines, and we have weekly deliveries of Pfizer and biweekly deliveries of Moderna coming into this country. At about 1 million a week right now, and as I said, 8 million prior to the end of this month. And in terms of the other approved vaccines, J&J and AstraZeneca, we have had AstraZeneca doses coming into this country, 500,000 from the Serum Institute last week, in fact. And the J&J timeline for delivery is something that we are working on with our supplier, and they should be letting us know soon when our deliveries will begin in Q2. That's in the spring and the summer.
Okay. Any idea? The Prime Minister's been saying at first it was everybody's going to be vaccinated by September. Has that moved up any?
Well, I really want to be cautious about putting out timelines because we have to remember that earlier in this year, we did see production delays from Pfizer. We don't expect such delays anymore, but we want to be cautious, and as a result, we're making sure that we stick to numbers that we know deliveries are going to continue, they're going to ramp up, but for sure, everybody will have access to a vaccine prior to the end of the summer, if not before.
Okay, Minister Anand, thank you very much for joining us today on Morning Live.
Thank you so much for having me. Take care.